Before you begin, ensure that you have all the necessary equipment for the procedure. Before you start the procedure, we will give you a brief situational history and provide any other relevant patient information. Ensure that the laryngoscope is functional. Be sure that the light works and the blades are of appropriate size. First, check that the cuff on the endotracheal tube can be inflated and deflated, and that there are no air leaks. Deflate the cuff and then insert the stylet. After recognizing that the patient needs oxygen, suction the oral cavity. Put on the oxygen mask and pre-oxygenate. Aspirate blood to ensure the IV axis is working. Administer medication such as sedatives and muscle relaxants. Remove the mask and ensure that the oropharyngeal airway is the correct size. This can be done by measuring from the corner of the mouth to the angle of the mandible. Insert the OPA into the oral cavity with the tip of the curve facing the hard palate. After reaching the posterior wall of the pharynx, rotate it 180 degrees. Prior to intubation, pre-oxygenate the patient with the bag valve ventilator for up to 1 minute. Remove the OPA and tilt the patient's head back. With your non-dominant hand, insert the curved blade of the laryngoscope into the mouth. Follow the midline till the tip of the blade reaches the vallicular. Lift the laryngoscope upward to expose the vocal cords and laryngeal opening. With your dominant hand, insert the endotracheal tube directly between the vocal cords and into the trachea. Stop when the cuff passes through the cords. Remove the laryngoscope and stylet. Inflate the cuff on the endotracheal tube with about 10 to 15 milliliters of air. To confirm the intubation was performed correctly, connect the capnometer to measure end-tidal CO2 levels. Attach the tube to the bag valve apparatus and ventilate the patient. Observe if there is symmetrical chest wall expansion. Connect the tube to the ventilator and turn the ventilator on. When the tube is in the correct position, use the tape to secure it into place. After you have finished the procedure, remember to clean up your working area and dispose of all waste into the appropriate bins.